Hello everyone, welcome back to Sedok Health, a platform where you get to ask all those biting questions concerning your health and you are duly answered. We are trying to bridge the gap between the doctor and the patient by giving you the right medical knowledge so that you can make better decisions concerning your health. As usual, a lot of questions came in, biting questions. One particular one stood out, asked by so many people: irregular menstrual periods.
You ought to know your health.
Welcome back to Sedok Health. I'm here with my colleague today, Dr. Dan Sechiunga. Dr. Dan will help us understand what irregular menstrual periods are.
Thank you. Before we understand irregular menstrual periods, let's first understand what is a normal menstruation period. As we all know, menstruation is part of a woman's life from puberty until menopause. So menstruation occurs roughly once every month, where a woman bleeds from about 2 to 7 days. The menstrual cycle length is about 21 to 35 days. However, the average cycle length of many women is about 28 days. If your duration of bleeding is less than 2 days or is more than 7 days, it is still abnormal. I also want to talk about what we call intermenstrual bleeding. This is bleeding in between your periods. Now, once you bleed in between your period, it's a marker of a disease that is happening in your body. The major causes of bleeding in between your periods could be just from a simple infection of your cervix or to a cancer of your cervix or the lining of your womb. So once you bleed in between your periods, it's better to check it out.
So, Dr. Dan, what are these particular causes of irregular menstrual period?
Irregular menstrual periods can be normal, especially among teenagers and also ladies that are approaching menopause. However, there are other causes of irregular menstrual periods and some of them may need treatment. Among these are a condition we call polycystic ovarian syndrome. We have talked about this syndrome before. A woman with this disease will majorly present with irregular periods, usually excessive body weight, hair growth around their body, sometimes painful periods with excessive bleeding, and failure to conceive. Other causes of irregular periods may include things like a thyroid disease or what we call a goiter. Once you have a goiter, you may eventually develop bleeding problems. Among other causes of irregular periods are things like obesity, excessive body weight. Also, excessive weight loss, especially in athletes trying to lose a lot of weight, may have irregular periods. Cigarette smoking and excessive alcohol intake can also affect your regularity of the periods. A problem with your brain can also cause irregular period. There's a hormone produced by the brain, a certain chemical that causes a woman's breast to produce milk. It's called prolactin. Once you have excess of this hormone, you can also have irregular periods. This is the same reason why lactating mothers or breastfeeding mothers may have irregular periods.
Thank you so much, Dr. Dan. We have learned the causes. What about diagnosing the problem? Doctor, how is this done?
So if you think there's a problem, most times there's a problem. So the best thing is to visit the doctor. In the doctor's office, the doctor will do an examination. Say for example, he finds a lot of hair in your chest. This may be suggestive of what we call polycystic ovarian syndrome, a disease that comes with an imbalance of your hormones. He may also do some blood tests we call a hormonal profile to see if your hormones are well balanced. Some other tests that can be done include a scan of your lower abdomen, we call a pelvic scan.
We have learned about the causes. The big question remains, how do we treat irregular menstrual periods?
So if you are a breastfeeding mother, if you're a girl at puberty, or a lady approaching menopause and you're having irregular menstrual periods, you probably don't need to worry or visit the doctor because this is a normal occurrence. The commonest and first-line treatment of irregular periods is using birth control pills as they help in balancing your hormones. Other treatments of irregular menses will depend on the cause. Say for example, if you have a goiter, it will probably need to be treated so as to treat the irregular periods. For people who are obese or overweight, you need to reduce your body weight by doing exercises. Remember, exercise is supposed to be in moderation as excessive exercises can also cause irregular menstrual periods. You also need to have a diet that has a lot of fruits and vegetables. You also need to stop cigarette smoking and reduce alcohol intake. In a nutshell, irregular periods can be a normal occurrence for lactating mothers or breastfeeding mothers, for girls around puberty, and for ladies approaching menopause. However, they may also be a sign of an ongoing disease, so you may need to see a doctor for a checkup.
Thank you so much for sticking with us to the end. Remember, like this video, share with your friends. Remember, sharing is caring. Subscribe to the channel and click that bell icon so that you're always notified whenever we upload a new video. Sedok Health.
Ask the doctor.